July Tobacco-Free Tuesdays webinar. Welcome to all of you. Continue to put in the chat your favorite sport to play or watch, but I will kind of start our webinar now. You see the familiar faces on your screen. We have Carrie, a regional coordinator from the northern region, Nicole from the eastern region, we have Tiffany from the Northwest region, and I'm Gina Roberts from the Southwest region. Sarah Burkhead, whose Central region, is on vacation, a well-deserved vacation right now. So we hope she's having fun at, I believe she went to NAGS then, so enjoy that. But we're gonna go ahead and get started. If you know our webinars, you know that we like to do a what's the tea question at the very beginning, and this one is no different. So our question today, and again, it goes back to our sporting theme, our outdoor theme, but we're going to put the poll question up there for you to answer, and we do want you to choose just one. What is the biggest challenge to outdoor tobacco-free policies like parks and stadiums? So the first one, no one knows about the policy. No one follows the policy. The lack of knowledge about health impacts, since they're outside, it's okay. Policies can be disproportionately punitive to certain groups. Policies can be confusing due to lack of consistency. Some may be, just tobacco-free. Some may not include smokeless or vaping. Some may have smoking sections, or other. Put in the chat. So please take a couple seconds to choose the one you think might be the biggest challenge. We know they're all challenging, don't we? But what's the one that you feel is the most challenging? Okay, a couple more seconds, and then Carrie will show us the results of that. Okay, here we go. Okay, we had one, the most challenging policies can be confusing to lack of consistency, 36%, with the lack of knowledge around health impacts coming in a close second. Yes, definitely, because some people don't know what the restrictions are outside, whether you can use smokeless tobacco, whether you can vape, whether it's just tobacco, the traditional cigarette. So definitely that. And we really need to educate our communities as we're kind of trying to implement these policies in the outdoor settings. We really need to educate about these things. Now, Sarah, I will tell you, always gives me some little fun facts to show or to mention. So I will mention a couple fun facts on this topic. Of the 30 Major League Baseball stadiums, 20 prohibit smoking, including the use of electronic cigarettes anywhere inside the stadium. And of the 32 National Football League stadiums, 29 prohibit smoking, including the use of electronic cigarettes. And of course, we all know all public Virginia K through 12 stadium and fields on school property are comprehensive tobacco-free. So a couple questions that I just wanted to throw out before Rebecca starts. In looking at that, look into your community and where do your minor league stadiums stand? Are they tobacco-free? How's enforcement at those K through 12 high schools in our area? There's some things that we can really at a local community level start rising up and looking at the policies and making sure that they are comprehensive tobacco-free. So I love to look at those facts to know what the big picture is and how we can bring it down to our local level in the communities. So I'm going to start now, just introduce Rebecca, and I think you will, Nicole and Sarah and I met with Rebecca a couple weeks ago, it's probably a month ago now, and she was just very engaging and so enthusiastic about this presentation, and about not just this presentation, about partnering with us, the Virginia Tobacco Control Program, and also the local communities in bringing her knowledge and technical assistance to us. So I'm going to introduce Rebecca Padilla. She's a leader in both health systems change efforts and evidence-based nicotine and tobacco use disorder treatment in clinical and public health settings. Rebecca has worked for the American Lung Association since 2015 and serves as the national manager for tobacco programs and tobacco cessation content expert for the American Lung Association. Rebecca manages a national project that offers expert technical assistance to state and local tobacco control programs, health systems, and community partners. And this is where I think Rebecca is just very open to working with all of us on this call to really further those health systems changes. Rebecca lives in Albuquerque, New Mexico with her husband, daughter, and I love the 3 German Shepherds. So exciting. Thank you so much, Rebecca, for joining us. I'm going to turn it over to you, and I look forward to hearing your presentation.
Awesome. Thank you so much. Yeah, I joke around that my husband and my daughter and I, we live in our dog's house because 3 German Shepherds definitely take over. So I am sharing my slides with you all right now. These will be made available to you after this presentation, along with any links that we might share. Just really quick disclosure, I don't have any disclosures or conflicts of interest. Thank you so much for introducing me and letting me chat with you all today. So I'm going to be talking about the impact of vaping on lung health, specifically for young people, and looking at asthma and athletes and their athletic ability and how we can really work together with other folks and partners in our communities to address this very important topic for youth. So I just also want to state really quickly that all references that we are making today to tobacco or tobacco products is in relationship to commercial tobacco products. And that includes everything from smokeless to vaping, dissolvables, as well as combustible products like cigarettes, cigars, hookah, and cigarillos, or the little cigars. So I just would like to make that quick note. And I want to talk to you really quickly about what's our inspiration for today. So in my introduction, I work for the American Lung Association, and for over 115 years, we have been the trusted champions for lung health across the country. And one of those important measures and missions that we have as the American Lung Association is to end the commercial tobacco epidemic. And, you know, we have so many main focal points on this right now. Myself and our team across the country are working really hard with folks just like you to really help protect lung health and overall health for everyone. And we do this really through education, awareness, advocacy, and research. So if at any time you have any questions about the work we're doing, whether it's during the presentation or at a later time, don't hesitate to reach out to the awesome team there in Virginia. They can connect you with us directly, or you can visit our website. So really looking at what is the need by the numbers here. The numbers on the screen right now are from 2019, 2020. That's really the latest that we have. But as I'm sure many of you know, the US Surgeon General has declared e-cigarette use a youth e-cigarette epidemic. And, you know, the evidence is sufficient in the rise among not just e-cigarette use, but also dual use, which is where folks, we'll talk about this a little bit more in a few minutes, but folks might use more than one commercial tobacco product. And we see a distinct correlation between folks that use e-cigarettes and use additional products. So they're compounding their addiction to nicotine and tobacco products. You know, among youth, a study concluded that there's substantial evidence that e-cigarette use increases risk of ever using any of those combustible tobacco products like cigars or cigarettes. So this is a huge risk factor for young people, not just in Virginia, but of course across the country. And on your screen, you'll see some of the key points that I thought were really important to highlight today about the Surgeon General declaring that youth e-cigarette epidemic. And it was a huge increase from 2015 to 2017. The numbers are still coming in about how use rates may have been impacted by the pandemic, of course. So we're getting those numbers and those datas in right now, and we'll be updating everyone on that, of course, as soon as we have a good, clear picture of that. But one thing we saw in the pandemic, obviously, was the importance of our lung health, and the importance of lung health across generations and demographic age ranges. So really important work here. And I know there's some great tools that are Virginia specific that we're going to speak about as well. One of the most concerning factors here is flavored e-cigarettes. So, I know some of you have been working in and around commercial tobacco product prevention and control for years and years and years. Remember the battle days when there was lots of flavored products on the market that were directly marketed towards young people. Well, those got taken off the market, thank goodness, and have been really replaced with flavored e-cigarettes. And of course, we know that that directly appeals to young people. We've seen when using e-cigarettes, young people really don't consider them to be in the same product class as combustibles. And the flavored marketing approach really compounds that and confuses what is and isn't safe for folks. On the screen are a couple of the really, really popular e-cigarettes right now that are, directly marketed towards young people. You can see they're very yummy flavors, something you might find in a soda or candy, blueberry, banana, mint, they have watermelon, and these all contain nicotine. Something I really want to talk to you about that's emerging right now that you may start to hear more about is synthetic nicotine. So this is on the screen is the chemical chart for nicotine. Synthetic nicotine is on the left. The other nicotine that we would find directly from the tobacco plant or other sources is on the right. They are basically similar, indistinguishable actually. And we've seen in lab studies that it's nearly impossible to differentiate the two. But this is another marketing ploy that the tobacco industry is using to market these products specifically to young people, saying it's not the same, and really taking that big harm reduction stance. And we know that that is just not the truth. So I just wanted to highlight this for you all really quickly. Again, it's very new to the market, but it's growing. So I want to be sure that this is something that you all keep on your radar as you're working to support your communities throughout Virginia. So again, there's few studies focusing right now on synthetic nicotine products. So there's really not a big difference chemically between synthetic and real nicotine. And little information is known about the specific use patterns as specifically for adolescents, young people, and looking at to see if there is any distinguishable differences between synthetic nicotine, commercial products, and the ones that use tobacco. So again, as I mentioned a little bit earlier, so many young people use 2 or more tobacco products. In 2020, as you can see on the screen, nearly 3 of every 100 middle school students, so those are 6th, 7th, and 8th graders, about 3 out of every 100 and about 8 out of every high school students reported using 2 or more tobacco products within the last month. And we know that when people, regardless of their age, use multiple tobacco products, their dependency on nicotine grows exponentially. And that means it's more difficult for them to recover. They experience more recovery symptoms. And we know there's such a clear evidence base that when young folks, especially those, under the age of 25, 24, 25, their frontal lobe is still developing. And that's where these addictions really carve a groove. And it's incredibly difficult. Once someone starts, their journey into adulthood with a nicotine addiction, it is very difficult for them to break that and recover. It's not impossible though. And I'm going to talk to you later in our meeting today about some great tools that you might be interested in that are available now or very soon that can help young people recover. So looking at, again, national youth tobacco use. There is some clear distinctions here between kids that are using those combustible products like cigarettes versus e-cigarettes. And we've seen this, distinct decline in combustible product use, but a huge exponential increase in e-cigarette use. So it'll be really interesting to see what the data show moving forward, to see if the pandemic may have impacted access, if it may have impacted use rates. So that's something, we really want to keep an eye on and monitor so that we can be responsive to what our communities are going through. So e-cigarettes were really first marketed in the US as a harm reduction product. And, that really insidious marketing ploy was very impactful. And it's something that I know the folks at the Virginia team and our team here at Lung, we've been working so hard to educate people on what the truth is. So these products were marketed as harm reduction products and also as a tool to help people quit smoking. However, we have seen over the years that neither the safety nor the efficacy of these products as cessation aids have been evaluated, not when they were first released, and they are not considered by the FDA to be safe or effective products to help adults quit smoking. And if anything, we have seen an evidence base that shows that these products sustain and increase nicotine dependency. So vaping really affects the body in numerous ways. And first of all, nicotine may cause inflammation across the body in all organ systems, but specifically to the lungs, which may worsen asthma symptoms and other chronic disease states that folks might be going through. I'm going to focus today specifically on asthma because obviously that's a high prevalence in our young folks across the country. And while we continue to monitor the research that, research outcomes pertaining to lasting health consequences of vaping, the Lung Association is really troubled about the evolving evidence that we're seeing about the impact of e-cigarettes on lung health. So, these products were really mass released across the country about 2015. So we have a very relatively small amount of data to look at. So it's going to be really interesting to monitor this over the years to see what the long-term impacts are. We just don't know at this point. But e-cigarettes also contain other chemicals aside from nicotine, and they contain things like acrolein, which is an herbicide. It can cause acute lung injury as well as chronic lung conditions. And research has really proved over the last 5 or 6 years that the inhalation of harmful chemicals that are contained in e-cigarette aerosol can cause irreversible damage to the lungs and can cause lung disease or exacerbate what's existing. And, e-cigarettes both contain and emit these potentially toxic chemicals, both through inhalation and through that secondhand exposure of aerosol. So, it was such a great question at the beginning of this to, find out what happens when we put our policies into place in public, spaces. Is there that misconception that because you're outside or because you're using an e-cigarette, it's not dangerous? And that's just not true. So that's where it's so important that folks like you, talk about the truth to folks in your community. So looking specifically at vaping and asthma, it increases inflammation, which is going to exacerbate asthma symptoms across the board. And that holds true whether we're looking at youth or adults. So really important to know that it increases inflammation in the airways. And what this inflammation does is it intensifies asthma symptoms and it triggers asthma attacks. And it can increase the risk of chronic lung disease, including asthma and COPD, by 30%. And it increases, respiratory tract infections, risk of throat and eye irritation. And as I mentioned earlier, it increases, especially for adolescents, that risk of using other commercial tobacco products. Another chemical that's contained within e-cigarettes is glycerin. So glycerin is in a lot of products. Some of it is food safe and safe for oral consumption, but it's not safe for inhaling. So it's an additive that can cause irritation and inflammation within the airway. It can also really exacerbate asthma. So many things to consider here when we're looking at why we don't want youth around these products. So, again, when youth or young people use these nicotine-containing products and they inhale them, they're at a higher risk of cough. It increases mucus production in the lungs. It can cause airway restriction or chest tightness, which can exacerbate anxiety and further that cycle of just not being able to breathe. It increases the risk of being exposed to bacteria and viruses and exacerbating the infections that they might cause. And finally, it also inhibits the lungs' capacity to heal itself. So that inflammation and that increased mucus production can really inhibit the body from being healthy and recovering like we want it to. And this is incredibly important for young folks. So I have a couple of questions that I would love to just learn a little bit more about what you think today about youth using e-cigarettes. So Gina, Carrie, Nicole, can you push out my first polling question? I would really love to know if you think people with asthma are more likely to smoke or more likely to use other commercial tobacco products. So I would really love for you to take a guess out here and see. And we'll give you all a couple of seconds to answer. And Virginia team, I'll let you close it out when you think the numbers look like a lot of people have been able to click on that true or false question. So again, do you think people with asthma are more likely to smoke or use other commercial tobacco products? All right, let's go ahead and close it out. So really, a lot of you, 69% of you think that folks with asthma are less likely to pick up a cigarette. And actually, the contrary is true. Unfortunately, we have seen a real increase in risk of prevalence of use among young people and adults that have asthma. And, we're trying to discover and explore a little bit more about why there is an increased risk there. But some data shows that, some recent surveys show that e-cigarette use specifically is also more popular among young people with asthma than their non-asthmatic peers. And I'm happy to get the team that journal article if you would like to see the hard data on that and the numbers and the sample, as well as a recent study of over 6,000 US high school students found that e-cigarette use was independently associated with asthma. So we have seen over the years that those combustible cigarettes, the ones we, light with a lighter and produce smoke, that those have an increased association with folks with asthma, but we're seeing the same use pattern with e-cigarettes. So, what can be done to address this? And how do we talk to young folks, especially folks with asthma and our athletes that are, having fun and doing what young folks should be doing, which is engaging in healthy, fun activities? How do we talk to them? It's difficult. Vaping can cause so many different issues with athletes. On the screen is a substantial list, and it's not even everything about what it can cause. I have another polling question for you all. So I would love to get that out to you. I know in the very beginning of this, we kind of chatted in the chat box about what everyone's favorite sport is. And of course, this is not a expansive list at all, but I would love to know what your guess is on what sport is most associated with youth commercial tobacco product use. So I'm talking about young people using Chew or Dip, Copenhagen, the little skull pouches. I'm talking about kiddos using e-cigarettes or other vaping devices, commercial, combustible tobacco products, whether it's hookah, which was really popular a few years ago, or cigarettes or cigars. So we'll give you another couple of seconds to take a wild guess here. I was very surprised when I saw the data on this. My guess was wrong. So Virginia team, if we can see what the results were. 81% think it's baseball. That was my initial guess as well. And I think we have traditionally seen, baseball players in the dugout with that big chew in their cheek and spitting. And we've seen a lot of that. Thankfully, Major League Baseball made a ruling sometime back that they have banned those products from their games and for their players, thank goodness. But actually what we see in the numbers is that wrestling and young folks that are in wrestling had a higher odds of past 30-day use than their peers, regardless of what other sports peers were playing. And a big reason for this is wrestling participants, those young people, have to do weight cuts. And unfortunately, over the years, we have seen that nicotine-containing products reduce appetite and can lead some people to lose weight. So unfortunately, it has really been suggested to young people that they can use this as a way to drop weight so that they can be in those weight classes that, their coach and their team, want them to be in. So really, concerning numbers there and concerning for why they're being used. So again, though, adolescents who participate in baseball and softball, they're next in line. And we see, higher odds of them across the board with a higher use rate. And I know that the numbers are probably kind of hard to see. It's very tiny, but we'll get this and the links out to you if you want to dig in a little bit deeper to these numbers. We have data on golf, lacrosse, swimming, diving, and then other sports as well. So really concerning here, though, in particular, when we're looking at kiddos that are in baseball or softball, they also, had those higher odds of recent e-cigarette and combustible use. So potentially dual use products. So compounding and increasing the level of nicotine that their body is getting dependent upon. So very concerning here. So we have also seen a few, key takeaways here on e-cigarette use and specifically what we've seen with young athletes and vaping. So we have seen that participation in multiple sports is a bit of a protective measure. So if you have young people in your life, Please encourage them to, get out there, have fun while they're young. And we have seen that protective factor. And involvement in certain sports like soccer might be more likely to reduce the risk of traditional cigarette smoking, or exposure to those other products. I promise you, I'm not sponsored by Major League Soccer. I would love to be, but for some reason, there's just not a cultural association within that sport of using chew, or especially not smoking, just because of the high rate of running that they do. And then we've also seen that, conversely, other sports like wrestling might increase the risk of prevalence of use. So just something to keep in mind there. And if you are out in the community promoting, prevention programs in Virginia, or if you're looking at, helping folks understand how they can help youth quit these products, it's really important to maybe look at who are our wrestling coaches in our school. Who can you get in front of and chat with and let them know that you've seen, this data, share this information with them, and talk to them about, is there a culture of using unsafe products to help youth drop weight? That can be a really key talking point, especially, for coaches and parents. And we've seen that adolescents, again, involved in baseball and softball, again, they have a higher rate use of those traditional combustible products. So on the screen, those little cuties there are my nephews in another family. They're my honorary nephews, and they play wrestling and baseball. So great kiddos, but just wanted to share that cute little picture with you all. So looking at some prevention resources that we have from both the Lung Association and from our national partners as well. There's some great information that's been put out by the FDA and Scholastic. They have co-developed some resources for educators, and we'll be sure we get you all this link. Really great information, including student magazines, lesson plans, activity sheets. So really promoting this from multiple directions is key. For years and years and years, we have primarily focused on prevention, which is the platinum best practice, right? We don't want young people to start in the first place. So prevention is so incredibly important here. However, we also, want to talk about how do we help kiddos and young people that have started using these products. But, when we're looking at schools, policy is incredibly important. So we do have our Vape-Free Schools initiative, which includes model language that folks can download for policies, for, enforcement policies as well. We have an entire toolkit that's available on lung.org. And this includes our in-depth training, which is available at no cost. And this is an alternative to suspension program. So it's not a cessation program per se, but it helps start those conversations of why it's important to quit, why these products are, dangerous to young people. It can be really difficult to chat with them, though, and get them to recognize health impacts that are further down the road. So we have worked to address that with our partners across the country with our youth cessation programs. So looking at these three, you can find links to these on lung.org. I'll definitely share them with you. But looking at these, we have, in-depth that I just mentioned, which is our alternative to suspension program. We also have two different modes of our NOT, which is not on tobacco. It's an evidence-based cessation program to help youth recover from any tobacco product use. And we have both the in-person or virtual options, and then we have a self-guided web-based program as well. And I know that there's a fantastic Live Vape Free program that's available through the Virginia state team. So I don't know if someone on the Virginia team can drop the Live Vape Free VA link in the chat box, but I would love to invite you all to click on that in a moment, take a look around, and explore what's available right in your own backyard. And so I have a little QR code here. That's the link for the demo for our Not For Me program. So this will be included in resources and links that are made available after this webcast. But I just wanted to quickly point that out for you. Additionally, the CDC is working on addressing both youth tobacco use and asthma together through their C-Care and Exhale initiative. And this is where health systems change really comes into play. I could spend hours talking to you about this, and I would love to in the future if you're interested. But I just wanted to put this up on the screen. Again, we'll have the link for you. If you're in a health system, if you provide that clinical care, this is a great place to look at the tools that are available and the strategies that work to help address both tobacco use and asthma amongst young people. And we have tons of additional resources that are available at lung.org. We also have our Keep Your Head Out of the Cloud campaign, which is geared towards parents that think, oh, not my kid. Or I've talked to my kid already, they would never smoke, but they might pick up those e-cigarette products. So we have conversation guides. We also have information available in Spanish as well. And again, for those of you that are working within health systems or with health systems, our team, my team specifically created a roadmap last summer to specifically address youth use. You can access it via the QR code. It'll download the PDF for you, or you can find it via that URL that's on the screen right now. This is really geared towards those clinical provider sites. So how do you modify your EHRs? How do you bill? How do you find more information on what might be safe or effective? And that's something that's really being explored right now by the American Academy of Pediatrics. So last year, they rolled out their clinical considerations package, and this is, again, geared towards clinicians. And it discusses what can be used, what they're seeing being used with young people. We know that, unfortunately, as of right now, mid-July, there's not an FDA-approved quit medication that's specific to youth. But this package really discusses the risk factors that clinicians can consider when they're thinking about treating youth to recover from nicotine dependency. It's got lots of great information, fact sheets, and the links on the screen. Again, we'll get that out to you after this webcast. We have lots of additional trainings that you might be interested in as well after viewing this webcast. They're all on the screen. They are not, scheduled or anything. They're on demand. They're free. They're really great for a wide variety of folks, whether you're, volunteering on a tobacco coalition, or you're working directly to help people recover, or if you're a parent or just a concerned community member. All of these are really great free trainings that are available through the Lung Association, as well as cdc.gov. So they have so many quit resources that are tailored and available for free for all kinds of folks. So whether you're, again, a clinician, to a parent, to the young person that might be using these products and maybe might want to look at quitting, CDC has tons of resources. The ones that are listed are just a few that are available. And of course, we have the Live Vape Free initiative from the state of Virginia. And maybe the team can discuss that a little bit more and the tailored, tools that they have available. But I would love to open things up to you all and let's chat a little bit. So what are your questions that you might have about the information I presented today. I know I crammed a lot into a very short time frame. So I would love to turn things over to the team and see what folks are thinking.
Hey, Rebecca, it's Nicole. Thank you so much for that great presentation. I was trying to follow up at the same time as link everything. So apologies if I missed some answers that you have, but we do have 2 questions live that we'll go over, and then I'll switch back to the questions from registration.
Sure.
So we're kind of referring back to when you're talking about athletes and then youth with vaping. So back to the athletes. It was a little after you had the poll about like wrestling and athletic use. So Liddell asks, have they studied the effects of smoking in athletes, such as decreased performance? I think you touched on it, but I don't know if you had any specific studies.
So absolutely, there are quite a few studies. I'm thinking of a couple that are out of California that I can pull and I'll share with Nicole and she can send it out to everyone. But yeah, so we see the same patterns, right, of decreased lung function, an increase in inflammation, which can lead to, if an athlete, falls and hurts their knee, that increase, that generalized inflammation can impact their healing. It can impact access to care, in that sometimes if a surgeon sees that someone has nicotine in their system, they may delay a surgery that is needed to help their recovery until they are nicotine free. So that's why it's really important that providers are checking for this and are helping young people recover as well. But that generalized inflammation is a big problem. The other thing that really is concerning is looking at the other chemicals outside of nicotine that are in e-cigarettes. So I mentioned glycerin. We've also seen tocopherol, which is vitamin E, and that's used as an emulsifier. And that really helps all of the other yuck that's in these products, stay bound together so that they don't separate. And when I'm sure some of you on the line today remember a lot in the news before the pandemic about EVALI, and that's e-cigarette and vaping associated lung injury. And we saw a lot of that towards the end of 2019. And of course, unfortunately, the pandemic happened and we shifted, but we've seen a direct correlation between that ingredient of tocopherol and those other emulsifiers and EVALI, or lung injury, because it actually coats the lung tissue. And what that does is it impacts and inhibits oxygen exchange. So this is going to, impact every area of an athlete's life, from brain function to lung capacity to heart rate increases, which, really concerning for football players. We've seen a lot of young, usually men, that drop on the football field from cardiac issues that weren't previously identified. And this can exacerbate the risk of that. But I will get those studies out for Nicole and the team to send out to everyone.
Perfect. Thank you. Yeah, feel free to send that to us, and then Carrie will send out a follow-up email. I'm going to include all the links from the chat. So I know I sent a lot, so don't feel like you guys have to link them and open all of them. And so anything that Rebecca sends us will also be in that follow-up email. So our other question that we got live today was from Hannah, and she is asking this, referring back to the vaping kind of resources and education. So she asks, when or where do you believe vaping prevention should start?
Oh, that's a great question. So in the past, we have started in middle school, right? We've looked at, starting to talk to 6th graders as they grow up, but we're seeing these products being used in elementary schools now. And I, again, can show you the data on that as well. So the earlier, the better. I'm a parent myself, and my kiddos are a bit older now, but I recommend to my family, my friends that have younger kids, the minute they leave your home, start talking to them about why these products are bad for them. They're dangerous. And they have been, marketed as products that are safer, and they're not. So really using those keywords like those are dangerous. And letting them know in very clear terms. You don't have to get into the weeds with them when they're 5 or 6, but starting that conversation is really important.
Yeah.
So when we're looking at treating youth, that's very difficult. So the FDA, again, has not approved any medications yet for, safe, efficacious use or use in youth. And, that's something that's really important for the provider to consider. They're already using these nicotine products. Is it better to get them to a NRT, which is the nicotine replacement therapy, which is a medication that can help them recover as they quit? So that AAP guide is really key. Additionally, a little quick plug for the American Lung Association. We have a training that's coming up. I'm clicking very quickly through my slides. So in this additional training, we have our act to address youth cessation, which is going to be available literally any day right now. So I was hoping it would be available today. It'll be available on lung.training, and we'll get the link to the team here in Virginia. They'll send it out to all of you. And that's a really great brief intervention training for anyone that might come into contact with youth to help promote recovery. So that's a great training. It'll be out any day.
Perfect. I know you said traditionally it's like middle school, and you said talking about to kids when they're younger, just to let them know, these things are bad. And I know I've worked with out of EVMS in Norfolk. They've worked with like daycares and preschools with a program Halo, Healthy Alternatives for Little Ones. I know there's a section where they just kind of show them the product just so they know, like, this is an unhealthy product. So even just kind of starting that as they're young, like you were talking about, just so they kind of know, because, we've seen kids younger and younger using, tobacco products. In addition to also having those daycares and preschools instilling tobacco-free policy can also help too.
And something really important too is looking at those young folks that might be at a higher risk of use, and really specifically, zoning in on them and helping support them. So when we look at youth that might be turning in their inhalers to their school nurse so that they have an inhaler available, or, they're turning in their sports physical paperwork so that they can play a school sport. Really important that, there is a process in place that clearly outlines the dangers of these products, along with other substance use risks that they may be addressing in these young people. So, making sure you're working with those specific programs to talk to young people is critical.
Very true. And I think you might have touched on it, but I'm going to link the Surgeon General's. They have a document for parents on like a tip sheet, and it kind of has like questions that youth may ask, just to kind of give parents a guide of like how to start that conversation with youth. I know that's kind of difficult sometimes too.
It can be. And one of the difficult issues with that, and something, I was thinking about in this presentation, is a lot of adults that are in the orbit of young people use these products, right? And, how do we work with our coaches that might be using these products? Or how do parents that maybe aren't quite at the stage they need to be where they can successfully quit, but they don't want their kiddos getting addicted like they are, how do they talk to young people? And it's important to, especially when we're looking at promoting this in schools, community centers, in programs in the community, that we are making a clear distinction with the adults. It doesn't matter for this moment what they're doing off school grounds or off field. You're there to help them when they are ready to quit, but let's focus on the young people. So a lot of times, folks have this real issue of, well, I use the products. What do we do? This is where, again, those organizational policies come into play, right? The coach should not have chew in his cheek or her cheek when they're on the field with the young athletes, right? They should be an across the board tobacco-free policy. And in that great icebreaker question that we had at the very beginning, there is, that component of, is it confusing? Do people know what tobacco products are? When we say tobacco products or traditional tobacco products, people think of cigarettes. And that's it. They may not understand that there are different products that are not safe, that, can lead to cigarette use and are also banned under these policies, very important for parents, for attendees at the games to understand. And, not just being punitive and kicking them off the team or off the field, but being sure that we also have resources available to help them quit.
Definitely. Thank you. And I did want to just briefly talk about, I know you mentioned our resource, Live Vape Free. And so I did link that in here. And again, it'll be in the email, so don't worry. But it is kind of a two-part resource. So there is an online version, and it's kind of courses or classes, kind of lessons for parents. There's also like interactive things, and parents can log on and take it whenever they want. They can go out of order. They don't have to do everything in one sitting, or it's not like you have to do A, B, C in order. You can kind of switch it around. And then there's also the second part that's for youth, and it's text-based only. So I know I registered just so I can see, what the messages are and everything. And so they do give you, kind of random messages every day, every so often. And I haven't responded because I wanted to see if they stop texting me, but they still try to send you encouraging messages. They'll send you games to kind of distract you. And it's just interactive because we know for youth, it's, they most likely won't go online. So it is text-based only.
And I'm glad you brought that up because, we've seen that evidence base, especially over the last couple of years, that youth need something that they can access when they want to, and they can access, online or via text. And I too subscribe to a lot of the text to quit programs that are available. I'm sure if someone went through my phone, they would be, they would laugh at all of my quit smoking texts that I receive every day. But really great opportunity there to both work with parents and with young people through the programs that are available through the Virginia team and the program, Live Vape Free in Virginia. So great products or great programs to help people stop using these products.
Great. Thank you so much. And I've kind of gone through the question. I think you've either answered them in your presentation or during the Q&A section. So I think we kind of covered almost everything. So I'll try to pass this on to Gina for her to wrap up. And in case I missed anything, you can mention anything, Gina. Thank you again, Rebecca.
Yeah, thank you. Have a great day, everyone.
Thanks, Nicole. Rebecca, thank you so much for your engaging and very informative presentation. I had what really resonated with what you just said a minute ago. A lot of the coaches in my area with the schools that I work with, they do use smokeless tobacco. And so it's really trying to work with those coaches to be role models for their young people when they get into that sport. So I think that is a challenge for us as we're working into the communities to do that. I had another quick question. I know we're running right on the end. When you mentioned earlier that people that had asthma were more likely to use tobacco, I put false. I thought that was not true. And you said it was. Any reason for that you've heard about?
Yeah, there's some compounding factors there. And again, I will pull some data for everyone and some studies that have been done, but it is multiple factors. It can be cultural in that they're raised in a home that they're exposed to tobacco products. It can also be nicotine, for some folks, they feel like by using a nicotine product, it decreases their anxiety. Now, a lot of times folks with asthma and other lung conditions, and I'm speaking from firsthand here, have an increase in anxiety because when you can't breathe, nothing else matters, right? So it can help kind of dull the experience of that for folks sometimes. But again, it's multiple factors. It's looking at that. But yeah, it's kind of mind blowing, right? You would think someone that thinks about their lungs a lot, like an asthmatic does, wouldn't be at a higher risk rate. And then, of course, if we look back historically, the tobacco industry targeted doctors at one point in the 20th century to promote cigarettes to their patients with asthma. Like how? Yeah, so it really interesting stuff, so many factors. That's why that, multi-level, diverse, comprehensive approach is key.
Very good. Thank you so much again, Rebecca. Very fascinating. And I appreciate all the links that you put out there. Nicole, as she mentioned, they will be in the follow-up email to everyone. Rebecca is such a great resource, the American Lung team. So please feel free to contact her and use her resources. The Virginia team is always here as we again start working in those local communities to change those systems to make our areas tobacco-free, comprehensive tobacco-free, and educate them, our communities, to what that means. So again, thank you so much. Please put August the 16th, 10 o'clock on your calendar for our August Tobacco Free Tuesday webinar. Share this with all of your colleagues. Please join yourself. We would love to just continue to keep our numbers very high. Again, thank you all for coming today. Stay cool. It is very hot here. And I know, Rebecca, you're probably out in New Mexico. You're probably just extremely warm.
Just a little over 100, but we don't have humidity. So it's a little different. Yeah.
Right,
It's
exactly.
toasty though.
Well, thank you. And everyone take care, and we will see you in August. Have a good one.